Before we get started, I just wanted to do a quick acknowledgement of country. So I just want to acknowledge that this work was created on Whadjuk Noongar country in Boorloo, Perth, Western Australia, and has obviously been shared here with you today on Wurundjeri Woi Wurrung country. So I want to pay my respects to the elders past, present and emerging, recognising that fertility and the diversity of minds and bodies has always been part of the human story on this land. So today I'll be talking to you about why approximately 50% of IVF patients stop treatment and how emotional readiness can change everything. So last year, I asked 6 women going through various stages of infertility treatment one question. What do you wish someone had told you before you started? And I got multiple different responses. So one said, everyone offered help after I was already falling apart. Another said I felt completely alone. Another said I was so overwhelmed with information I didn't know what was real and what Dr. Google was saying and whether they were making things up. So these 6 women told me exactly what was missing, and I listened, not just as a researcher, but because I've been in those chairs too. So I'm going to share with you some of what they've told me today. But before I do that, I want to tell you about a Tuesday in 2023. So 4 patients are all falling apart. One's having panic attacks in the car park. Another is saying she would rather die than do another egg retrieval. A third couldn't stop crying. And a fourth was dissociating so hard that she couldn't remember driving to her appointment. And I'm sitting there as a psychologist thinking, I should know how to fix this. But here's the thing. I did know how to fix this, at least professionally anyway. So I'm Liz Bancroft. I'm a clinical and counselling psychologist. I'm an accredited EMDR and resource therapist. I am a member of the Fertility Society of Australia and New Zealand. I am an IVF veteran and I have a special interest in trauma and infertility. So I've got 14 years of clinical experience. I've got a master's degree. I've done my EMDR training. I'm DBT certified. And I even had colour-coded spreadsheets for my own IVF protocols. Like actual colour-coded spreadsheets, I'm not joking. But none of that professional knowledge protected me from how IVF broke me open. So I had 13 years of battling infertility personally. 5 of those years were in active treatment. I was spread across 3 different clinics because apparently hope springs eternal, or I'm just stubborn. And I had 6 miscarriages before I had my son. So I knew exactly what these 4 women in my clinic on that Tuesday needed because I had needed it too, and I hadn't got it either. So that Tuesday I was watching brilliant, capable women, one after another, fall apart in the same way I had, and I just thought there has to be a better way, one that actually works. And so here's the plot twist that I didn't know then. Is years later, once my son was old enough to start displaying his own symptoms, I figured out that I'm also autistic. All of that sensory overwhelm of the clinics, in the waiting rooms, the fluorescent lights, the beeping machines, the crying behind curtains, this isn't just IVF stress, this is your nervous system under a genuine assault. And those difficult questions, that I kept asking, was my brain trying to create safety through information seeking. And the colour-coded spreadsheets, yeah, okay, maybe that should have been a clue. But nobody saw it. Nobody accommodated for it, and the system just expected me to cope. So that Tuesday was my turning point in my clinic. If I, with all my training and all my credentials, struggled this much, how are people without that level of support supposed to survive IVF? And so I went away like a good autistic person does, and I deep dived into the research. And when I saw these numbers, 25 to 80% of IVF patients dropping out of treatment, which is age dependent. So the older you get, the more likely you are to drop out. 58% of these patients cited that psychological burden was the reason why they dropped out. So I then asked myself, well, what do these patients actually need? And then here's what I did, which was revolutionary, is I asked them. You know, it's groundbreaking stuff, right? 6 women, different stages, and I just listened, which honestly should just be standard practice, but apparently it isn't. Nobody prepared me. I felt completely alone. The clinic lights overwhelmed me, but I was too embarrassed to say so. I couldn't keep up or remember what the doctor was saying because I was crying so hard, and they made me feel like I was difficult when I asked questions. So, show of hands who's ever been told by a medical professional, just relax, as their medical advice, right? That's what I thought. So these aren't research findings, these are real experiences, and they're probably your experiences, or they will be. Every woman told me, I wish somebody had prepared me and I wish I hadn't had to figure it out alone. So that's what Hope, Affirm, Thrive does. I prepare you before you're drowning. Revolutionary, right? So those 6 women told me what was missing, and then I had a choice. I could wing it based on my lived experience and go, oh, well, that worked for me, that'll work for everyone else. Or I could be systematic and actually, think about it and be research-based. So I had one client say, help came too late, and so my program offers you treatment before you start. Radical concept, preventative care. Another said I felt alone, so I turned it into a group program, peer support, because misery loves company, but in a therapeutic way. Another said the lights overwhelmed me, and so I teach sensory accommodations. It turns out you can just ask them to dim the lights. Who knew? Or wear sunglasses. Another said I couldn't remember anything the doctor was saying, so I support you guys in asking for everything to be in writing, because I'll remember this is a lie we all tell ourselves. And then another said that she felt difficult when she asked questions. And so this program provides self-advocacy training, or as I call it, how to be difficult on purpose. So every single feature exists because a real woman told me she needed it. And yes, I documented this. I did a thematic analysis of it. And I just found out last week that it is going to be published in the Neurodiversity Journal. Because women's voices deserve to be heard in healthcare. And because my imposter syndrome insisted that I write it all down properly. So here's also what surprised me. 7 out of 8 women who saw me, at least, who thought they were completely neurotypical, their words, screened for high autistic or ADHD traits they'd never recognised. So plot twist is a lot of us are neurodivergent and we're just really good at masking. So suddenly things started to make sense. The sensory overwhelm of procedures, the difficulty processing information from, rapid firing from doctors, uncertainty feeling absolutely unbearable. It's not just IVF stress. And so for many, this might be how your brain naturally works and nobody's told you or taught you how to accommodate for it. I'm not saying that everyone's neurodivergent, but if you've ever thought, everyone handles this better than me, or why is uncertainty so hard for me, or why are appointments so overwhelming, or why do I need all of the things before I can relax? It might not be that you're not coping, it might just be that your brain's working differently and that nobody's accommodated for it, which is their failure, not yours. System issue. So in my program, I screen everyone. Not to label you, it's not a formal diagnosis, and for most people they fall under clinical cutoff levels, but it gives you some insight to actually support you. and individualise your treatment. So, novel concept, I know. So why do some people sail through IVF while others find it unbearable? Well, it's not because they're stronger, that's nonsense. It's about hidden factors. Medical trauma, sexual trauma, childhood powerlessness, neurodivergence, all of the fun stuff, really. But also autistic women have double the PCOS rate, higher endometriosis rates, and autism in women is often missed because we're really good at pretending to be fine. I've seen patients labelled as difficult who are experiencing sensory overwhelm. I've seen patients who are non-compliant who had ADHD and genuinely forgot medication doses, not because they didn't care, but because their executive functioning was like, nope. And then one told me that the doctors kept telling me to stay positive when I needed statistics and I needed backup plans. And so they weren't being negative, they were trying to feel safe. But apparently wanting data makes you a pessimist. So we know that generic counselling and coaching in this space doesn't work. Trauma-informed specific approaches do. So it turns out a one-size-fits-all Band-Aid approach doesn't actually fit anyone. So I want to tell you about a case study. So we've got Sarah, 32, unexplained infertility, excellent prognosis. On paper, everything looked great, and in reality, not so much. So the first cycle, she was anxious but hopeful. The second, she was having panic attacks in the car park and dissociating during scans, which, if you don't know what that means, it's basically your brain going, I'm out, and it leaving your body to handle things on its own. Not recommended. It is a good adaptive strategy. Then the third cycle, she cancelled and dropped out. And she said, I can't handle feeling this broken anymore. Every appointment makes me feel like a failure. And everyone told her, just relax, think positive, other women do this. And you know what nobody said? This is medical trauma and it's treatable. And that would have been helpful. So Sarah got trauma-informed support from me and we identified the medical trauma in her past. She learned to regulate her nervous system, and I went through some of those strategies in the workshop this morning. And that's essentially a fancy way of saying, teaching your body how not to freak out. We processed the trauma memories with EMDR. She developed self-advocacy skills and she connected with peers that got it. And then Sarah returned to treatment feeling more confident, not traumatised. And she said, I finally felt like a participant in my own care, not something being done to. And yes, she got pregnant. In fact, she's due in a month's time. But more importantly, she didn't end up needing intensive one-on-one therapy for months or years at a time to recover from the process, which feels like a low bar, but here we are. That's what's possible with the right support at the right time. So now some of you might be thinking, well, this is all nice, Liz, but I just want to get pregnant. Why should I care about psychology? And that's a fair question, but here's why. Biology. This isn't new age wishy thinking or thinking really hard about your ovaries. It's actual science. So we know that chronic stress disrupts your HPA axis. It affects hormone profiles, medication responses, elevated cortisol levels, which you've heard some of the other clinicians talk about today, impact egg quality and implantation. High inflammation in distressed patients interferes with reproduction. And research recently shows that stress hits hardest at egg retrieval. So lower stress equals better outcomes. So your nervous system essentially needs to feel safe in order to prioritise reproduction. When your body thinks it's being chased by a tiger or, just trying to survive another 2-week wait, reproduction takes a backseat. And that's not metaphorical, that's biology. Your body is literally going, tiger, no babies, survival first. So you're not too stressed to get pregnant, you're just having a normal response to abnormal stress. And it's treatable. Unlike the tiger's still a problem. So, are you emotionally ready? Do you actually need me or this program? Green flags means that you're equipped. So if you can advocate without over-apologising, if you can stay present during procedures, as in your brain and body are in the same room, if you have stress tools that work, not just have you tried yoga or mindfulness, if you can remember appointment details without writing everything on your hand, and if you can recover from setbacks in days, not months, and if you feel supported, when I went through treatment, I had barely any of these, except the support, which I then refused to take. Different problem. Which is why I'm the cautionary tale. Red flags, though, means you need support. Not that you're not ready for treatment, just that you need to implement support at the same time. And I'm going to go through these quickly because there's a lot, and not because you're broken, but because the system is broken. This is a system issue. So some of the red flags around your body are if you're panicking before appointments, dissociating during procedures, your brain's ghosting your body. If you have memory gaps and you're thinking, the doctor said what now? If you're agreeing to things passively that you're not comfortable with because you can't access no in the moment, these are all red flags. Your brain under stress. If medical environments overwhelm you, lights, sounds, textures, the one nurse who talks too loud and I wanted to punch in the face. You need information presented in specific ways, or it sounds like Charlie Brown's teacher. If scheduling feels impossible, inject what, when, how many times? Exhausting yourself by just appearing fine. These are all red flags. And then there's your history. If you've been told once upon a time you're too sensitive your whole life, which is code for your needs are inconvenient. If your reactions are dismissed as just anxiety, as if anxiety isn't a real thing. If you've learnt to hide your distress because showing it made things worse for yourself and for your relationships with others. If you've been labelled as difficult for needing accommodations, which is just people telling you to be smaller. If you're recognising these red flags, that doesn't mean you're not ready. It just means that you're ready for support. And with the right support, people stay in treatment. You don't become a discontinuation statistic. These aren't character flaws. They're nervous system responses and they are fixable. So here's what the research shows from 6,000 women. Good news, psychological support works. Large effect sizes on anxiety, depression, well-being, PTSD. Turns out talking about your feelings actually helps. Revolutionary. The problem is most of this research studies CBT, not because it's the most effective for complex trauma, but because it's the easiest to study, which is like researching medications that are easy to test rather than ones that actually work the best. But I digress. The gap is that when you've got medical trauma, triggered past experiences, nervous system dysregulation, core beliefs about being broken, basically the full combo of psychological distress, you need more than just challenge your negative thoughts. You need trauma processing, you need EMDR, you need nervous system regulation with DBT, you need belief transformation with schema therapy. And this is what my program delivers. And it's about to be documented in peer-reviewed research because my imposter syndrome wouldn't let me not write it down. So remember Sarah, who cancelled her third cycle because she felt broken? Here's the rest of her story. Trauma-informed assessment. We treated the medical trauma. She regulated her nervous system, processed with EMDR, developed self-advocacy skills, connected with peers, and the final outcome was that she completed the treatment with confidence and fell pregnant. Okay. So what can you do today? Normalise the stress first. Having a strong emotional response doesn't mean that you're weak or unprepared for parenthood. I was the trauma psychologist and I still fell apart. And if I can have a degree in this stuff and still cry in a clinic waiting room, then you're doing fine, okay? Use the red flag, green flag system. If you're seeing red flags, that's information, not failure. It's your nervous system going, hey, I need some help over here. And then third, learn basic regulation techniques and connect with others who understand, others who really understand. Not your well-meaning friend who got pregnant on the first try and thinks that she gets it. Bless her, but no. And professional support, I've developed a tiered approach. So you might not need this all, but tier 1 is self-paced tools, immediate access, no wait lists, 6 months, that's ridiculous. When you're in crisis, you need help immediately. If you need tier 2, we do weekly group coaching across 6 weeks in a peer group where we do spot EMDR to desensitise any acute stress responses. And then tier 3 is where you do the full EMDR workshop to process any past or current trauma. So we're matching support intensity to your actual needs when you need it. But here's what you need to remember. Remember, 25% to 80% discontinuation rate. It is largely preventable with the right support at the right time, and prevention is better than crisis intervention. If we're making a choice as a healthcare system, we have to make a different choice. We know that this stuff works. We know the data supports it with large effect sizes. We're just ignoring it and we're not using it because we're classic humans. The question isn't whether you should seek support. It's, do you want Band-Aids or do you want healing? Do you want, here's how you cope with feeling broken? Or do you want, let's process why you feel broken in the first place and then stop that from coming up in future? So if you've tried therapy before and it didn't really help, or if your distress goes deeper than the situational acute anxiety, if you know there's trauma underneath, this program is built for you. So don't let psychology be one of the reasons why you stop treatment. That would be ironic, and that's not the fun kind. One concrete action that you can take before you go, sign my petition. I'm currently lobbying the government to increase Medicare rebates for IVF patients because we need more support than what the government currently offer under a mental health care plan. We can't keep treating mental health as optional. Emotional well-being is not a nice to have, it is a need to have, and so I am determined to fix that. And so if anyone's got any questions, or if you want to experience these techniques firsthand, not just hear me talk about them, you can get in touch or you can download some of my free guides. There are also 10 free resources for Expo participants today as well that you can read in your own time. And if any of the questions are, where do you get your colour-coded spreadsheet templates, that is also a valid question. Thank you.